Hello everyone, welcome to my another session which is about development of gastrointestinal tract. These are the learning outcomes. Here I will be also covering the tongue and the pharynx because even tongue and pharynx is a part of the gastrointestinal tract. I will be covering the development of foregut, midgut, hindgut in different videos. And also I will be discussing the related congenital anomalies, and mainly I will be focusing on the rotation of the midgut and its clinical correlates. Now coming to the first part of the gastrointestinal tract is the tongue. The oral cavity. The tongue is situated within the oral cavity. So I had told you earlier in the development of the respiratory system that there is an area which is called as pharyngeal arches, okay, or pharyngeal apparatus, which consists of the mesodermal core called the arches, okay, and it has an external lining by the ectoderm and internal lining by the endoderm, and these arches are separated externally by the ectoderm, which is called as pharyngeal cleft, and internally by pharyngeal pouch. So this complete apparatus is called as a pharyngeal apparatus, which gives rise to the structures present in the neck, especially the pharynx, larynx, and also it contributes for the development of the tongue. So here the section has been taken at the level of the pharyngeal arches, okay, and you are seeing from the front. Okay, so these are the arches. As I told earlier in my video in the development of respiratory system, that pharyngeal arches are 6 in number. Okay, so one by one they appear on either side of the neck region, the developing neck region. Okay, so among the 6, the 5th arch disappears, and the remaining 1, 2, 3, 4 and 6 will give rise to the structures present in the neck region. So these are the arches on either side. So the mesodermal core at the center, externally is the ectoderm, internally the endoderm. The floor of the pharyngeal arches, when you see here, contributes for the development of the tongue. So you know that tongue is divided grossly into anterior 2/3 and posterior 1/3, and the part which terminates, which demarcates the anterior 2/3 and the posterior 1/3 is called as sulcus terminalis. Okay, and also at the center there is a foramen cecum. Okay, so the anterior 2/3 of the tongue is developed by 2 swellings. Okay, one swelling on either side which appears at the level of the floor where the first arches are formed. So these are called as lateral lingual swelling. Okay, and the one more swelling exactly at the midline, again at the level in between the first and the second arch. Okay, there will be one more swelling called as tuberculum impar. Okay, so there are 3 swellings, 2 on either sides, lateral lingual swelling, and one in the midline, the tuberculum impar. So these 3 swellings will give rise to the anterior 2/3 of the tongue. So mainly they appear at the level of first pharyngeal arch. So the anterior 2/3 of the tongue is contributed by lingual swelling, 2 lateral lingual swelling and the tuberculum impar. Then the posterior 1/3 is contributed by the swellings which appear at the level of second pharyngeal arch. Okay, also at the level of 3rd and 4th. So exactly at 2nd, 3rd and part of 4th arch, there will be one more swelling called as cupula or hypobranchial eminence. Okay, so second median swelling called the cupula or the hypobranchial eminence, which are formed at the level of 2nd, 3rd and also part of 4th, will give rise to the posterior 1/3 of the tongue. As I told in the earlier video that each arch has its own blood supply and nerve supply. Okay, so the first arch nerve is the mandibular nerve. Second arch is the facial nerve, and the third glossopharyngeal. Fourth and sixth is by the vagus nerve. Okay, since the anterior 2/3 of the tongue is contributed at the level of first pharyngeal arch. So the anterior 2/3 of the tongue, okay, the sensation is carried by the lingual nerve, which is a branch of mandibular nerve. Okay, and posterior 1/3 of the tongue, both the sensory is by the glossopharyngeal nerve, because it is mainly at the level of second and the third. Okay, so it's mainly the glossopharyngeal nerve, both the general sensory and the special sensory. Okay, so you know that tongue has a special sensation which carries the taste, right? So that's why at the posterior 1/3, it is mainly, the major part is at the third pharyngeal arch level. So that's why both general sensory and the special sensory, that is taste sensation, is taken up or is carried by glossopharyngeal nerve, which is the 9th cranial nerve. But here at the anterior 2/3, since it is at the level of first arch, only the general sensation is carried by lingual nerve, which is a branch of mandibular nerve. But the taste sensation is carried by chorda tympani, which is a branch of facial nerve. Okay, so this part of the second pharyngeal arch, some of the nerves, they migrate and they carry the function of taste sensation from the anterior 2/3. So that's why there is a difference between the nerve supply between the anterior 2/3 and the posterior 1/3. Then now coming to the muscles of the tongue, you know that muscles of the tongue is not contributed either by the lingual nerve or the glossopharyngeal or the facial. The muscles of the tongue are supplied by hypoglossal nerve, which is the 12th cranial nerve. Why? This is again an embryological reason we can give, that muscles of the tongue are derived from the myoblast. As I told, there are somites, the paraaxial mesoderm in the intraembryonic mesoderm, the mesoderm part which is lying on either side of the neural tube, okay, which will give rise to pairs of bricks which are called as somites, which has its own muscle block, then the dermatomal block, and also the connective tissue. Okay, so the muscle block, the myoblast, which are at the level of occipital somites, okay, the back side of the skull. So they migrate from that region and then they contribute for the muscles of the tongue, and they also carry the nerve supply, which is the hypoglossal, that is the 12th cranial nerve. So since the embryological derivative is different in the tongue, so that's why the nerve supply is also 3. Okay, so one is bilingual, which is a branch of mandibular carrying the general sensation from the anterior 2/3 of the tongue. Facial nerve, that is the chorda tympani branch, carries the special sensation, that is taste sensation, from the anterior 2/3 of the tongue. Posterior 1/3, both general and special sensation is by glossopharyngeal nerve. Okay, and the muscles of the tongue, which includes genioglossus, hyoglossus, then styloglossus, they are mainly supplied by hypoglossal nerve because they are derived from the occipital somite. So this is about the development of the tongue. The next, coming to the development of the pharynx. Okay, the pharynx, again they are from the pharyngeal arches. So mainly from the 4th and the 6th pharyngeal arches. 4th and 6th pharyngeal also contributes for the development of larynx. Okay, the cartilage and muscles of the larynx. Also, they also contribute for the development of the pharynx. That is all the muscles of the pharynx, which includes the constrictor muscles, inferior, middle and superior constrictor muscles. Then it includes the salpingopharynx, palatopharynx. Okay, so all those muscles of the pharynx are derived from the 4th and the 6th pharyngeal arch, which are supplied by vagus nerve, the 10th cranial nerve, because that is the nerve of 4th and 6th arch. Except there is one muscle which is called as stylopharyngeus, which develops from 3rd pharyngeal arch. So you had learnt in the gross anatomy, all the muscles of the pharynx are supplied by the vagus nerve, the 10th cranial nerve, except stylopharyngeus, which is supplied by glossopharyngeal because they are derived from third pharyngeal arch, and the third pharyngeal arch, the nerve of third pharyngeal arch is glossopharyngeal. So that's why, since this muscle is derived from third pharyngeal arch, this muscle is supplied by glossopharyngeal nerve. So this you have to remember. This is about the development of the tongue and pharynx. Now moving on to the gut tube proper. Okay, so you know that in the general embryology you had learned that due to the folding at the cephalocaudal region and also due to the lateral folding, there will be the endoderm, which was a layer. They form a tube called as the primordium of the gut tube. So they form an endodermal tube, which is a primordium which give rise to the different structures of the gut. So these gut tube, after the folding, due to the result of the folding, they form a tube and they are divided into three parts. The upper part is called the foregut, then the midgut and the hindgut. This is the foregut. Okay, then the below part is the hindgut. So the foregut extends from, this is the buccopharyngeal membrane, where the stomodium, which later develops into oral cavity. So there is a membrane which doesn't have a mesoderm, only the ectoderm and the endoderm. So this is called as buccopharyngeal membrane. So the foregut extends from buccopharyngeal membrane till the development of the liver. Okay, so there will be an outgrowth, okay, a liver bud. So till there, that gut tube is a foregut. Then caudal to the liver bud and till the left 1/3 of the transverse colon. Okay, so that part is the midgut. So this midgut is connected to the yolk sac. So this is the yolk sac within the extraembryonic coelom. It is connected to the yolk sac by a duct called as vitelline duct. So this duct which connects the midgut to the yolk sac temporarily, okay, so this is called as vitelline duct. Okay, then this is the hindgut. It communicates. So there is a small pocketing, a small derivative here, which doesn't have much contribution. So this is called as allantois. Okay, so it communicates with the allantois and extends till the cloacal membrane. So this is one more at the caudal region. Cephalic region has a membrane called as buccopharyngeal region, and the end part, the dilated ending part of the hindgut is called as cloaca. Okay, so this cloaca is in contact with the layer of ectoderm and this membrane is called as cloacal membrane. So this is the extension of the gut tube and also the division of the gut tube. So overall, the gastrointestinal tract, you have learned in the histology that there are different layers. The epithelial layer, then you have the mucosa muscularis externa, interna, the connective tissue which can be serosa or adventitia. Okay, so there are different layers in the gastrointestinal tract. So the epithelial lining, they are mainly derived from the endoderm. So the endoderm give rise to the epithelial lining of the digestive tract. Not only that, it also contributes for the specific cells, especially in the glands like liver and pancreas. For example, hepatocytes and exocrine and endocrine cells of the pancreas. They also are derived from endoderm. So the endoderm gives contribution to the epithelial lining of the complete digestive tract and the specific cells of the glands, which includes hepatocytes, exocrine and endocrine cells of the pancreas. Then the rest, which includes the connective tissue, the muscle layer and a layer of peritoneum, these layers are contributed from the splanchnic intraembryonic mesoderm. So you know what is splanchnic intraembryonic mesoderm, which I have explained in my earlier video on development of respiratory system. Okay, so the lateral mesoderm, the lateral intraembryonic mesoderm is divided into two layers by formation of an intraembryonic coelom. Okay, so the layer which is adjacent to the ectoderm is called as parietal or somatic mesoderm, and the layer which is adjacent to the endoderm forms the splanchnic or visceral mesoderm. Okay, so this splanchnic or visceral intraembryonic mesoderm gives rise to other layers of the gastrointestinal tract, which includes connective tissue, muscle, and also a layer of peritoneum. Three main branches of the dorsal aorta. They mainly supply the blood to the developing gut tube. Okay, the foregut, midgut, and hindgut. They receives three main branches. So these are the branches from the dorsal aorta. Okay, so the structures developing from the foregut, okay, they are supplied by the celiac trunk and their branches. Okay, and the structures developing from the midgut, they receive blood supply from superior mesenteric artery and their branches. Then the hindgut, the structures developing from there, they get blood supply from the inferior mesenteric artery and their branches. So these are the three main branches coming from the dorsal aorta, supplying the different parts or the different structures arising from foregut, midgut, and hindgut. This gut tube or the endodermal tube, they are suspended by two mesenteries, one on the dorsal aspect and one on the ventral aspect. So you can see here, this is the gut tube. Okay, so this is the foregut, then the midgut, then the hindgut. So they are suspended dorsally and ventrally by the mesodermal structure called as mesenteries. Okay, so these are mesentery, also called as, which forms the peritoneum within the abdominal cavity. So these peritoneum at different area, they have given different names, which you will be learning in the gross anatomy. Okay, so embryologically we divide this mesentery or the peritoneum into two layers, one lying dorsally, okay, and the one ventrally. So when you see here, the foregut, only the foregut tube has mesentery both dorsally and ventrally. They are suspended. The gut tube, the foregut tube is suspended both ventrally and dorsally, but the remaining midgut and hindgut is suspended only by the dorsal mesentery. Okay, so there is no ventral mesentery on the ventral aspect. There is only dorsal mesentery for midgut and the hindgut. Why? Because the ventral mesentery, which is suspending the foregut from the anterior aspect, they are derived from septum transversum. I had told you in the earlier video of the development of the respiratory system what is septum transversum. Septum transversum is a plate of mesenchyme, okay, derived from the mesoderm, okay, which separates the thoracic cavity from the abdominal cavity. Okay, so this septum transversum also contributes for the formation of ventral mesentery. Okay, so this ventral mesentery, you can see this is the diaphragm, developing diaphragm. Okay, so which separates the thoracic cavity from the abdominal cavity. So part of the mesoderm, they proliferate from the septum transversum and they form the ventral mesentery suspending the foregut ventrally. Okay, but the midgut and hindgut doesn't have that. They have only the dorsal mesentery, which attaches from the midgut and hindgut and gets the other part attaches to the dorsal body wall or the posterior abdominal wall. So this dorsal mesentery, as I told, the peritoneum, they are double layer. Okay, they have two layers and in between the two layers there is a cavity which is called as peritoneal cavity. Okay, so they are double layered peritoneum having a visceral layer which is completely in connection or attached to the visceras or the visceral organs, and the parietal layer which is covering the inner aspect of the abdominal wall. Okay, so there are two layers. So the double layer, in between the parietal and the visceral layer is the cavity which is called as peritoneal cavity. So these peritoneum is again nothing but embryologically they are called as dorsal and the ventral mesentery. So as I told, this peritoneum, they give different name at the different areas. Okay, so the dorsal mesentery which is attaching to the part of the tube which is giving rise to stomach. You can see the stomach develops from the foregut. So the part of dorsal mesentery which is attached to the developing tube which give rise to the stomach, so there it will be called as mesogastrium, dorsal mesogastrium, and there is also ventral mesogastrium. Okay, if it is attached to the part which give rise to duodenum, it is called as mesoduodenum. Okay, if it is attached to the colon, mesocolon. Okay, and the mesentery which is attached to the intestine, the tube, the midgut tube which give rise to small intestine, jejunum, ileum, so that part will be called as the mesentery. So depending upon the mesentery attached to the different area of the different organs, the name they have given different names. So the dorsal mesentery mainly give rise to greater omentum, which is called as the dorsal mesogastrium. The greater omentum have different parts. Okay, so greater omentum is a long sleeve of peritoneum. So once you open the abdominal cavity, okay, once the skin, the superficial fascia and the muscle layers of the abdominal wall is reflected, you will see a long sleeve of peritoneum, okay, peritoneal layer, which is called as greater omentum. So this includes dorsal mesogastrium, which is attached to the dorsal aspect of the developing stomach, dorsal mesoduodenum, which is attached to the duodenal part, the mesentery proper, okay, which the mesentery proper is the dorsal mesentery which is attached to the tube which will later form the jejunum and ileum, okay, and the dorsal mesocolon is the mesentery, the dorsal mesentery which is attached to the developing colon, that is mainly the transverse colon. Okay, so these all structures are derived from the dorsal mesentery. Okay, the ventral mesentery, which is only at the ventral aspect of the foregut, okay, they, as I told earlier, derive from septum transversum. They give rise to one more omentum called as lesser omentum. Okay, so lesser omentum is the area. So in the ventral mesentery, you can see there is a structure here. Okay, there is a visceral organ developing, which is the liver. Okay, so within the ventral mesentery, the liver bud appears and they enlarge to form the liver, okay, along with the extrabiliary apparatus. Okay, once the liver develops, the ventral mesentery is divided into two layers. One is lesser omentum, the other one is falciform ligament. Okay, so here within the ventral mesentery there will be development of the liver and the extrabiliary apparatus. So the divides the ventral mesentery into two areas. The area which extends from the liver to the stomach is called as the lesser omentum, and the ventral mesentery which is attached from the liver to the abdominal wall is called as falciform ligament. So the falciform ligament and lesser omentum is from the ventral mesentery. So this you have to know, it's very important, which layers are derived from which mesentery. This completes the development of tongue, pharynx and general concepts of gut development. Thank you.